Demo of Kybella. Kybella is a product that's been around for about over a year. When you hear about what Kybella can do, you're going to think that it's a wonder drug because what it is an injection that melts fat. Okay, so its main indication is for fat underneath the chin. Okay, and it's derived from something that is in your body. I like to say that a lot. It's derived from bile salts, which help you dissolve fats in your body. So when we inject Kybella into fat cells, they literally explode and fall apart. So that's appealing to a lot of people. Okay. All right.
Like head to toe.
Yeah, right. Let's have you sit up for a second here. So Brianna's going to be our demo, and what we're going to try to do is treat a little bit of this fullness right here underneath the neck here. Okay. This is called the submental area. Okay. And there's a number of things in this area that will affect. It can be our skin, it can be the muscles and the position of the bones in that area. But what we're going to do is inject our Kybella into this area right here, and immediately there'll start being some reactions. Probably Brianna will be able to tell you that she feels something, and you'll be able to see how easy it is to get done, and then we'll go from there. So the first thing I'm going to do is just put some marks on her skin that just act as a guide as to where we're going to put our product. I'm also going to mark, this is a really safe product, but we like to just mark some of our boundaries here a little bit. Nice. Let's see this sponge. So right now, yeah, we're just putting, one of those tattoos that kids like to put on their skin. It just marks the skin, makes a little grid. Pretty neat, huh? That'll wash right off. Tell you the truth. So what's going to happen is we're going to inject the product, and then probably within a few minutes, Brianna will tell you, oh, I feel a burning, I feel some heat, and some people tolerate just fine, some people find it a little uncomfortable. And what's happening is the fat cells are literally falling apart. And then the body has to clean it up. And so she'll probably feel a little full and swollen over the course of about a week. It'll be a little heavier and fuller underneath there. And then over a period of many weeks, it'll tuck up. So what I'm doing today is the amount of product that you have to inject will vary depending on how much fat we have to treat. The average person has to do about 4 vials. So today I'm doing 2 vials of treatment. Okay, so 2 vials is just 1. So we say most people should plan on doing at least 4 vials of treatment of this product. And you separate with Brianna, we would probably recommend a second treatment in about 6 to 8 weeks. And there's some evidence coming out to say that you'll see some results in 6 to 8 weeks, but you'll see even more results at 3-4 months. Because all that inflammation causes a tightening effect over time. Okay? Any other questions? All right, let's get it done. You ready?
Yeah.
Okay. I'm going to lay you back just a little bit here. Okay. This is a
You're clearing the room with them. Yeah.
Yeah, this is a very safe area to treat. You know, we do surgery in this area, and there's not a lot of little vital structures that we're near. We know what to avoid. We like to say that's an advantage of somebody who understands things surgically. What's the anatomy? You want somebody who knows the anatomy in this area. So it's not just the product doing the work; it's making sure the technique is done properly.
And how long should be swallowed for?
About a week is what we tell people. Yeah. So it's all in there. We've done 2 vials of product. We're going to put a little pressure on there for a little bit. How you feeling, Bree?
It's burning, but I mean it was the injections themselves. Easy. Super quick. Minutes post injection, and the pain is a lot less than it was just about 5 minutes ago. Barely feel it. It feels full, but it's not painful anymore.
What's the alternative to this? The alternative to doing what we did today is liposuction. Okay, so we do, liposuction to this area on a routine basis, and that also causes bruising and swelling. That can be done in 1 session, by a little more bruising and swelling, but not a lot of pain or discomfort. Can even be done in the office. There is a small incision involved with liposuction. It's about 3 or 4 millimeters. It's needed, usually in an area where a lot of people have a small childhood scar anyways underneath their chin. So liposuction is an alternative to that as well. Some people, the fat underneath the skin is not all of what they're seeing there. It could be skin laxity, it could be muscle laxity. So those are people we might be saying, well, Kybella is not the right treatment, or only is going to treat part of those things, and you might be a candidate for a neck lift or something to that degree. So the best thing is to start with a consult, ask one of us, say, hey, what do you think looking at my neck? Am I a candidate for Kybella? What should I expect? I would tell you that she's an ideal candidate. She's young, she's got great skin, she's got good skin tone, so when the Kybella kicks in, it's just going to do great. And she probably will, to get an ideal result, do some treatment sessions. We have some pictures of Kybella, people with 1 treatment session, 2 treatment sessions. Some of them are employees. A number of our employees have had this done, so you can ask. It's probably a lot of the research and development that's behind it. There's no product like it on the market. This product is sold by Allergan, so the same people who bring us Juvederm, who bring us Botox, they believe in Kybella, right? So I usually say, if you've got a multi-billion-dollar company like Allergan who's standing behind Kybella, they probably think it's got something to it. Yeah. Over time, there's changes. People might gain weight, they lose weight. You have the same number of fat cells in your body, it's just they change in size. Here we're decreasing the number of fat cells that you have.
Oh, I see.
Mm-hmm. So it's all relative.
Your body's not going to shift the cells. They're
Could
there.
Could you gain weight in that area
Yeah.
and those leftover cells create some fullness? Absolutely. Could you have skin laxity or other issues? Yes. But it seems pretty promising. Yeah.